When I first got licensed in 1980, shortly thereafter, my clinical practice became involved with two new diseases that we hadn't seen before. One was AIDS, and the other was Lyme disease. And in my first year of practice, I found that in spite of my excellent training with the top people in the field, the use of traditional formulas was giving me results only about 50% of the time. So I looked at my experience and training and decided that I needed to expand on this and look at Chinese medicine in a more modern context and to modify classical prescriptions and concepts in order to get positive results with my patients. There was no classical reference point for treating HIV disease. There was no reference that we could go to find out how to treat Lyme disease. So the fact that these new diseases were coming up and I was seeing patients with these problems at the time at which AZT was the only treatment for HIV disease and the side effects were almost worse than the disease process itself, led me to look at Chinese medicine from a more biomedical and laboratory-based perspective. Over about the last 10 years, I've spent a lot of my time at the web portal for the National Library of Medicine and doing extensive searches on the laboratory research on Chinese herbs. And there is an incredible amount of material. I probably have done over 10,000 searches over the last 10 years and maintained this very large database of all the different pharmacological aspects of traditional Chinese medicine. And one of the things that I found very early in my practice was that acupuncture treatment alone had sort of limited benefits for patients with autoimmune disorders. If they had lupus or rheumatoid arthritis or mixed connective tissue disease or Sjogren's syndrome, that the effects of acupuncture were either very transient or sometimes patients had significant exacerbations. They got much worse rather than better from treatment. And so this also led me to re-examine my training and to look at these things in a more critical manner. Autoimmune disorders are a very large part of our clinical practice because almost all autoimmune conditions result in some sort of pain syndrome. The inflammation that's triggered by autoimmunity oftentimes results in chronic pain that may not be well managed by traditional pharmaceuticals or conventional pharmaceuticals rather. And even the most innocuous of over-the-counter medications like Advil and Tylenol have significant toxicities when used long-term. I've treated children for Tylenol poisoning. I've seen many patients with severe gastrointestinal problems from the prolonged use of non-steroidal anti-inflammatories. And so we have a very important role to play in treating these diseases because conventional treatments have significant toxicities and limits in terms of their benefits. I want to begin by discussing the traditional Chinese medical theory in relationship to biomedical theory and the biomedical approach to illness. Acupuncturists in the United States are functioning within the Western medical model. Our patients come to us with laboratory work and pre-existing diagnoses, and we have to have the knowledge and the tools to be able to interpret these things and to act on them in an appropriate manner. And so one of the first insights that I had into the bridge between Chinese and Western medicine is that if we look at the pharmacology of Chinese herbs, we can get a much deeper understanding of traditional Chinese medical concepts. And the first of these concepts is the concept of wind. If we go back to the Huangti Neijing Suwen, there is a quote that says that wind is the cause of hundreds of diseases. And if we look at the Chinese character for wind, we'll notice that in the center of the character is the radical zong, which is an indication of the presence of an insect. And from my point of view, when I look at this, to me this is the symbolic representation of infectious disease. That the wind carries this insect, very small pathogen, that then creates illness. And if you look at the Chinese herbs that have wind-clearing properties and their pharmacology, we find that these medicines have very powerful antiviral, antibacterial, and antifungal properties. And this is one of the reasons why traditional Chinese medicine still has an extremely important role to play in modern society. Antibiotic resistance is a huge issue in contemporary Western medicine. There are certain pathogens for which there are no effective antibiotics. And all of us have had the experience of patients coming to us after their second or third or fourth round of antibiotics for a chronic condition that simply refuses to go away. Because Chinese medicine is intrinsically a polypharmaceutical approach in which we're using multiple herbs, we have the potential to treat these illnesses in a very effective way because the potential for the organism to become resistant to our treatment is much less, because we're not using a single molecule to inhibit the growth of a bacteria or a virus or a fungus, but rather we're using a very complex collection of antimicrobial substances which can, again, help to deal with the resistance issue. In Chinese medicine, joint problems and musculoskeletal disorders are often characterized as the combination of wind and dampness. And if we look at the Chinese character for damp, we see to the left side of the character is the radical for water. And at the top is the radical for the sun. At the bottom is the radical for fire. And in the middle are two characters that mean something very small or very thin. So what this represents is that the interaction of environmental causes like summer heat, the sun, and fire or inflammation can trigger a change in water metabolism, creating an accumulation of fluid in the joints, in the tissues, and this is the swelling that we see that accompanies diseases like rheumatoid arthritis and lupus. We also know from Chinese medical theory that dietary factors are an important issue in generating dampness, and that the excessive intake of sweet and fatty foods can trigger this damp accumulation or damp pathogen, which then creates other problems. And that, in fact, is something that Western medicine has just recently discovered in looking at the dietary causes of atherosclerosis, diabetes, obesity, which are all epidemic illnesses in the United States. Another very important concept in Chinese medicine that has a correlation to Western immunology is the concept of phlegm. In TCM, we say that the phlegm diseases are the most difficult to treat. They're the most stubborn. And if we again look at the Chinese character for phlegm, we'll see that the outer part of the character is the disease radical, the radical that indicates illness. And on the inside of the character is the radical for fire repeated twice. And this is an indication of inflammation. So phlegm diseases are the result of an inflammatory process in which fire alters the fluids in the body and generates dampness. If we look at this in the immunological context, what phlegm represents is a dysfunctional immune system in which the immune system manufactures antibodies against the pathogens, but rather than those antibodies sticking to the pathogens, those antibodies are accumulating in healthy tissues, creating an inflammatory response and making healthy tissues the target for other aspects of the immune system. And because these antibodies that are being manufactured are not targeting the pathogen in a specific manner, the pathogen is retained in the body. And therefore, the patient never completely clears the chronic infection that's triggering this inflammatory process.